what is ethnic rhinoplasty.
It's sort of an old-fashioned term, so I don't know if it's even appropriate for today's social
Modern
climate.
world.
The medical terms referring to rhinoplasty on patients of non-Caucasian descent.
And I said, where'd you go? I was waiting for her to say Turkey or overseas. And she said, here in Toronto. And it was Dr. Solomon. And
I'm going to pull out Tanisha's picture so we can sort of discuss what her goals were. She looks so beautiful, but she was beautiful before surgery too.
I think in your case, it wasn't so much that you didn't like the nose, it just didn't balance with the rest of your face.
Right.
So it made the rest of your face look almost out of proportion with the nose. So we can get into two sort of categories.
Yeah.
You're either adding an implant of some sort or you're adding some cartilage.
It sounds like Gore-Tex is maybe the better route to go.
Well, you may think that, but the worldwide medical opinion, that worldwide medical opinion, there was a pendular shift away from implants in North America towards rib. Hey guys, it's Dr. Solomon. I want to welcome you back again to another episode of Unfiltered. We now have one of our favorite patients who's a smiley, happy-go-lucky patient who underwent a septorhinoplasty a few months back, and she's going to talk to us about her experience, and I'm going to answer some questions related to African-American rhinoplasty, what's unique about it, what options are available, and what may make it a bit more complicated than some other types of rhinoplasty.
Hello, everyone. So we're going to talk about ethnic rhinoplasty, as Dr. Solomon indicated. And Toronto is a diverse city, so we see a population of patients from all over the world. And today we're going to talk about African-American rhinoplasty. So when you came to see Dr. Solomon, let's start at the very beginning. How did you hear of Dr. Solomon? What did you Google?
a friend of mine got hers done by Dr. Solomon, I believe 2 years ago. And she was my stylist, or is my stylist, and she was doing my hair. And I turned around and looked at her nose and said, did you get your nose done? And she said, yeah. And I said, where'd you go? I was waiting for her to say Turkey or overseas. And she said, here in Toronto. And it was Dr. Solomon. And I got the information. I got home. I Googled ethnic doctors in Toronto. And he was at the top of the list. And, did a few digging, research. And every time I searched what I was looking for, Dr. Solomon came up on top. So I chose him.
Nice. Okay, so Dr. Solomon, let's discuss or define what is ethnic rhinoplasty.
It's a bit of a funny term. It's sort of an old-fashioned term, so I don't know if it's even appropriate for today's, social
Modern
climate,
world.
world. But in general, I think the medical terms referring to rhinoplasty on patients of non-Caucasian descent. And the reason for that there are some differences in terms of the anatomy and what we're working with and the surgical planning. So in patients of either African American or often Asian descent, there may be differences in terms of what they're looking for and what is bothering them. So I'll just generalize it, but in general, they often have shorter noses, lower bridges, wider noses, thicker skin, and less defined nasal tips. So all of those are things that we're going to aim to sort of reconstruct and reshape with different surgical options. And then, so to summarize it again, we're aiming to raise the bridge frequently, refine the nasal tip, narrow the nasal bridge, and often narrow the nasal base. Those are kind of the common sort of things.
Lift the tip too.
And lift the tip as well. And that's sort of the main differences. And one other thing, just the two main features that we're working with are often thicker skin, but again, it's variable amongst different patients, and weaker cartilages. So, Caucasian patients, and this is a generalization as well, may have larger noses wanting to go smaller, they may have thinner skin, and they may have stronger cartilages, whereas Asian and African American patients may have thicker skin and softer cartilages. And again, these are general concepts. They don't apply to everyone, but those are kind of the things that we take into consideration when we're doing those types of procedures.
Do you see the Asian anatomy similar to, you said they're similar, but do you treat them the same when you're doing a treatment plan for a patient?
Every operation we do is individualized, but in terms of just general concepts, they're very similar in terms of the objectives of the operation are frequently similar in terms of raising bridge, narrowing tip, narrowing base.
So when you're comparing a Caucasian nose to an ethnic Asian African American nose, Are the risks the same?
The risks for rhinoplasty are, there's general risks and there's specific risks. General risks apply to all rhinoplasties, which can be bleeding, infection, poor surgical outcome, things like that, breathing problems. And then with regards to specific risks to these types of procedures, we're often adding materials. We're building up the nose. So in these cases, we can get into two sort of categories.
Yeah.
You're either adding an implant of some sort or you're adding some cartilage. And so I think probably what you're asking about is relating to infection of implant or infection of implant or cartilage grafting. And cartilage grafting can be divided again into rib cartilage, either your own rib, ear cartilage, your own ear, or cadaver material where we buy cartilage from a cadaver bank. And all of those have their own specific risks, but infection, extrusion, shrinkage, warpage of the implant or the cartilage graft can occur in any of these cases, whether it's African American or Asian American.
Okay, so let's turn it back to Tanisha and talk about her surgical plan and how you landed on a synthetic implant. So he had the consultation with you and he gave you options. How did you determine which way to go?
Well, in general, I'll answer it a bit, and then you can tell me what you chose, why you chose what you chose. So I tell patients that in our clinic, we do offer the whole range from implants to cartilage grafting. The implants that we do use are Gore-Tex. We don't use something called silicone, which used to be very big in other parts of the world, but I won't use it because the chance of it lasting forever is very low, meaning you'd have to replace it, similar to, say, a breast implant. But in the nose, synthetic silicone implants almost always will shift or extrude over time. So I don't really like using them. Gore-Tex implants is a totally different material. It's used in heart surgery, aorta surgery. It's been proven to be very safe for nasal surgery. It has got its own pitfalls and rare risks of shifting, moving, infection, but it's quoted at roughly 1% to 3% in the worldwide literature. And I trained with a surgeon who used it a lot, and I use it often in these types of cases, as long as the patient, is comfortable with the idea of a synthetic implant. What's good about an implant is, and again, the implant is really relating.
The purpose of the implant.
The purpose
Let's
of the
say that
implant
first.
is to build up the bridge of the nose.
Right.
I don't use implants on the nasal tip at all, so the cartilage is used no matter what on the tip of the nose. So it's sort of a hybrid case: cartilage for the tip, an implant for the bridge. The alternative would be using rib cartilage, either her own or a purchased cadaver graft. The downside of that is that it can shrink or warp. And so, and that's a conversation I have with every patient. And some patients say, I don't want to take a chance that it can shrink or warp. It also may not be perfectly smooth, whereas implants can be customized and shaped. And because it's a synthetic material, it's very smooth and generally can be custom fitted and carved into a shape that'll look ideal. So those are the pros and cons. Synthetic implants can be smooth, customized, whereas the cartilage graft can potentially shrink or warp over time. So you
So
almost
this
have
conversation is all about building up the bridge so that it looks taller,
taller
and
thinner.
narrower.
Taller and narrower.
Taller and narrower. That's why we're talking about
That's right.
the graft.
Correct.
Okay. Gotcha.
Yeah.
All right, so now,
Okay.
your conversation with Tanisha. You offer her both the rib, you offer her the implant, the synthetic implant. What
Yeah,
were your
well,
thoughts?
yeah.
Did you know this was going to be a conversation,
No.
having done your research? No? Okay. So you researched the doctor, but not the technique?
Right.
Okay.
I had no clue.
Okay. So how did you make your decision?
Well, the rib, I believe it was my age we were concerned about.
If to use your
That
own
was an
rib.
option. Right.
Right.
So I chose the Gore-Tex. Is it the Gore-Tex?
That's right.
Which was, there was no shrinkage. So after listening to Dr. Solomon, we decided that
So you
was
didn't want to
the-
take the risk of putting in a cadaveric rib
Right.
graft that could possibly shrink
Right,
over time.
over time.
Okay.
The other thing is we have had patients that we've used rib cartilage and we've almost oversized it a little with anticipation of it shrinking. And then we've had the odd case where they feel it's too high, which we can go back and shave down, but it's sometimes very stressful for the patients because we have to give it time. So you've seen some of these patients that we've done rib cartilage grafting, they've been oversized. I've had the odd case where I've done Gore-Tex, thought it looked incredible. The patients, for whatever reason, decide they don't want a foreign material in their nose, and elected to change it to a rib, and it's looked bulkier and hasn't looked quite as refined.
Which is your preference?
I don't really have a personal preference because I have some cases which I've done with rib, which I love, and I think they look amazing. And I have other ones with Gore-Tex that look terrific. It's more you judge it on case-by-case basis. And then when you get a complication or a side effect, you sometimes wish you did the alternative treatment. So when a rib graft starts to shrink, it's frustrating because you know you've put it in and then you're there's an element that's out of your hands. You're waiting for the patient's body to integrate the rib into their nose. And if it starts to shrink too much or it doesn't look perfectly smooth or one side shrunk more than the other and they have a bit of an asymmetry, then it's obviously frustrating for the patient, but it's also frustrating for me. I've had the odd case where I've done rib. It's looked really good. A year later, it looks like it's shrunk a bit, and the patient's requested me to augment it again by adding more rib, and it's sometimes very hard to go back and add more rib on top of rib. And in those circumstances, I've occasionally put in Gore-Tex on top of the rib. So because the Gore-Tex comes in sheets, you can get like 1 millimeter, 2 millimeter, 4 millimeter. So sometimes you can just, primarily have the rib and then just use the Gore-Tex almost as a camouflager just to be very smooth and raise it just slightly more. And they feel good about it because they have less foreign material in their nose.
So when you talk about all these risks and variables, it sounds like Gore-Tex is maybe the better route to go.
Well, you may think that, but the worldwide medical opinion, there was a pendular shift away from implants in North America towards rib. And a lot of that had to do with some very good rhinoplasty surgeons were showing that their techniques of rib grafting had become so good that it was better than using foreign materials. But many of them over years and years, when you follow patients, have noticed that sometimes they do still warp despite excellent surgical technique. With regards to rib, there's one other interesting fact. With the rib cartilage grafting, they're either solid or diced. Solid means you cut an actual piece of rib, you custom shape it, and you place it into the nose. That's sort of the way I was taught it initially. But over decades, many surgeons have preferred something called diced cartilage, where you take the rib and you chop it up into almost tiny, tiny little fragments, and then you glue it together, and then you use the glued graft into the nose. Now, the advantage of that is that it's better, you're more able to shape it. It's sort of a soft graft, and then it solidifies into an ideal shape. So the problem with the diced cartilage grafting, it's supposed to reduce the chance of warping. So if you have a solid thing like a piece of wood, the whole thing can warp and turn like a C shape. Wow. Whereas with the diced graft, you've removed the warpage, but you may increase the potential of resorption. So I do primarily diced cartilage graft when I do use rib. I like it better. I'm able to shape it a little bit better, but we have seen the odd case where we have to go back and add either Gore-Tex or more cartilage.
I'm going to pull out Tanisha's picture so we can sort of discuss what her goals were. She looks so beautiful, but she was beautiful before surgery too. So here's Tanisha before. So let's just go over what her goals were for surgery and what we've improved upon.
Yeah, so we've got Tanisha's photos preoperatively, and she looked gorgeous preoperatively, but her main objectives were to raise her nasal bridge and her nasal tip a little bit, almost creating an illusion of a slightly larger nose that would fit better in with the rest of her facial features. So I think in your case, it wasn't so much that you didn't like the nose, it just didn't balance with the rest of your face. Right. So it made the rest of your face look almost out of proportion with the nose. And so you can look at the level of her eye and you can see that the nose almost starts right at the eyeball, whereas now we've raised the bridge, something like 6 millimeters so that it basically balances the nose with your other facial features. And it's not that you needed such a different nose, you just wanted a slightly different size nose to balance everything. So that, I think that's sort of what we were able to achieve. She looks basically the same, just a bit more balanced. And I think it really did enhance your overall, to me, aesthetic. But again, it's all how you perceive it.
Right.
Are you happy with your nose?
I love it. I absolutely do.
Yeah, you look great.
Thank you.
Yeah, you really do. You look terrific.
Thank you.
Every time we see you, you're smiling, so it gives me good feedback, which makes me happy. Yeah. Patients being happy makes the surgeon happy every time.
So, Tanisha, what advice do you have for other people considering rhinoplasty surgery, ethnic rhinoplasty?
Just do it.
You're how old? You're in your 40s?
43.
Okay, you're 43.
I wish I did it a little bit sooner, but
that is always the common theme. Everybody often says, like, usually when people come in, they're ready to book surgery because they've been thinking about it for about 10 years. So I guess you were one of those people.
Yes.
Okay.
And here we are. So I'm
extremely
happy.
So in other words, just do it if you're thinking about it.
Exactly.
Yeah.
do your research and stay local, get it done.
Yeah, in Toronto.
Yeah.
Nice.
All right. Well, thanks so much for the confidence in choosing me as your surgeon, and really appreciate your feedback and your help participating in our episode of Unfiltered. It really helps people, I think, make their own decisions in an informed way. So thanks to Tanisha, and thanks everyone for tuning into our episode of Unfiltered, and we'll see you shortly with another episode.